Welcome to the LewisGale Regional Health System Joint Replacement class. Now that you and your physician have decided that surgery is the best treatment for your condition or injury, you may have a multitude of questions and concerns. Surgery is a major commitment because it affects your lifestyle for several weeks and sometimes months after surgery. Planning for surgery can be overwhelming, but you can make it easier on yourself and your family by being prepared and knowing what to expect. This presentation has been created to walk you through every phase of your surgical process. Our goal is to provide you with the information so that your questions are answered and your stress and anxiety are decreased. We'll begin by discussing the first step following your decision for surgery, the pre-admission process. This process includes pre-admission testing, documentation review, and a detailed nursing interview. Let's begin with pre-admission testing. Your physician will schedule an appointment for you to have all of your pre-admission testing completed. Testing may include lab or blood studies, an EKG to evaluate your heart rhythm, a chest X-ray, and an X-ray of the joint that is being replaced. These studies are performed for your medical clearance prior to surgery. During your pre-admission visit, we'll review several documents to ensure that we have all of the information that is needed during your stay. This includes your insurance card, personal identification such as your driver's license, a complete medication list that includes dosages and how often you take them, a drug allergy list, and a copy of your advance directive. A part of your pre-admission process is a detailed nursing interview. During this interview, you will be asked questions about your medical and surgical history. It is important that you are completely honest during this assessment, as this information will help guide your care. The nurse will also discuss your current medications and will direct you on medications to take the morning of your surgery. Remember to have a detailed list of all medication and dosages that you currently take. Your nurse will be happy to answer any questions that you have during this interview. Let's discuss a few things that are important to keep in mind prior to your surgery. First, remember not to consume food or liquids after midnight on the evening prior to your surgery due to complications associated with anesthesia. This includes mints and chewing gum. Failure to follow these instructions could delay your surgery. The morning of surgery, take only the medication the pre-admission nurse has instructed you to take safely. Take these medications with only a sip of water. Please attempt to stop smoking at least 1 week prior to your procedure. Bathe or shower the night before your surgery to ensure your skin is as clean as possible before the surgery. Your physician may have you use a special soap for this bath or shower. Please remember to wash your hair the night before as well. Please remove any nail polish and makeup prior to arriving at the hospital. Finally, if you experience a change in your health, such as a cold, cough, or a fever, contact your doctor as soon as possible. If you suspect you may be pregnant, also notify your physician. Anesthesia and medications may be harmful to your baby. Let's review what items you'll need for your hospital stay. The first is, of course, a positive attitude. Your success and great outcome begins with you. You've also received an education booklet that outlines your joint replacement. This book is full of great information that will help you in your recovery after surgery. Remember to bring your complete list of medications along with the dosages and frequency of use. Pack comfortable, loose-fitting clothing. You may wear your own clothing after the first day of your stay. Comfortable nightwear can also be used. Make sure that you packed a comfortable pair of walking shoes that have a non-skid sole. You will be using these when walking with your caregiver. The hospital can provide you with some personal items. However, you may want to bring your own. These include the toothbrush, toothpaste, mouthwash, shaving supplies, bath soap, deodorant, bath powder, lip moisturizer, and your comb and brush. Now that you're packed for your hospital stay, our physical therapist is going to show you some exercises to do at home prior to surgery and what you need to know after surgery.
Physical therapy is a really important part of your recovery process after surgery. I'll be going over some exercises with you that are really important to get your best range of motion and your best strength before you have surgery. And these are the exact same exercises that you're going to be doing after surgery, whether you are having a knee replacement or a hip replacement. These exercises are just as important. So the exercises, we want you to complete all of them twice a day, and each time you do the exercises, we want you to do them 10 times each, and I'll demonstrate them for you now. So all of the exercises can be performed on your bed at home, a nice firm surface that gives you support. And the first exercise is just as simple as pumping your ankles up and down. This is a really good exercise just for getting circulation in your legs and maintaining that range of motion in your ankles. Okay, the second exercise is called a quad set or a knee press. And the idea is you want to squeeze the muscles in the top of your thigh like you're trying to squish something down into the bed beneath your knee. You want to hold this exercise for 5 seconds each time you do it, okay? This is a really good, strong contraction to really get that quad strength back, and it's important for both knee and hip replacements. The next exercise is more of a range of motion exercise. It's called a heel slide, and you'll be sliding your heel across the bed up towards your bottom while you're letting that knee and that hip bend. Now, you want to take advantage of your full range of motion here. You don't want to stop shorter than what you have. So get to the point of discomfort and hold it there for a second or two before you let it relax back out. Now, pain is a normal part of the rehab process, so just be aware of that. We don't want to cause you excruciating pain for no reason though. So listen to your body, get to the point of discomfort, and then slide it back out nice and slow. The fourth exercise, you're going to need a pillow for this exercise. Now, when we tell you after a knee replacement, you should never rest with a pillow underneath your leg. This exercise is the one exception. So you'll lay down in bed and bend your knee over a pillow very slightly. Then you want to straighten that knee up as high as it'll go and slowly let it relax down. And this exercise especially, but with all exercises, you want to make sure all of the movements are very slow and controlled. And again, you're getting the full range of motion available. The last exercise is typically the hardest. It's called a straight leg raise. So again, with your leg straight out in front of you, you're going to be lifting the entire leg straight up towards the ceiling and slowly bringing it back down. This is the hardest because this is a really big muscle group, and especially after surgery, it's going to be kind of weak, and it'll be the hardest one to get back nice and strong. So those 5 exercises are the most important for your recovery. If you can do them twice a day and 10 times for each exercise, that's best. Now, some of the knee replacement patients will use a machine called the continuous passive motion machine. And this is what a continuous passive motion or CPM machine looks like. It has a remote control here that we'll teach you how to use on the day of surgery. And the idea is your leg rests in here, it will slowly bend your knee up and straighten it back out. You don't really have to think about anything when this machine is going. You kind of relax in bed as this bends your knee and straightens it out. If your surgeon chooses to have you use one of these, it will be explained to you in further detail when the time comes.
Now we're going to discuss movement precautions following hip replacement surgery. These precautions will help prevent dislocation of your new joint. For this class, we'll be only showing precautions for the posterior approach. If your physician chooses another approach for your surgery, your care team will provide you with those instructions.
You're going to have 3 movement precautions in order to minimize the risk of dislocating your hip. Now, the precautions are no bending past 90 degrees, so that's this L shape here. So you can come to 90 degrees, we just don't want you going past it. So no bending over to get shoes, socks on, things like that. The second precaution is no crossing your legs at the knees or the ankle. You want to keep your legs nice and straight, or your doctor may put a wedge or a pillow in between your legs just to remind you of that precaution. And the third one is we don't want to point our toes inward. We want them nice and straight forward as mine are here. And you'll work with occupational therapy who can give you some adaptive equipment and assistive devices to maintain your independence while also maintaining your precautions at home.
It's the big day. We will now review what will happen the day of surgery and some last-minute reminders. When you arrive to the hospital, please report to the ambulatory care surgery unit. You'll be asked to change into a hospital gown and to remove your underclothes and socks. Also remember that you need to remove any hairpins or hair covering such as a wig or toupee. Contact lenses and glasses will also need to be removed and left with your family along with other personal items. Finally, any dentures or partials will need to be removed before leaving the ambulatory care surgery unit. You will be taken to the preoperative holding area next. This is the final step before your surgery begins. If you have not seen your physician or anesthesiology provider the day of surgery, they will visit you here to answer any questions you may have. You will also meet several members of your surgery team. They will make sure you are comfortable and ready for your surgery by reviewing your chart and asking a few more questions. When the OR team is ready for you, you'll be taken into the surgical suite by a stretcher. Remember, your questions are welcome, so if you have any more questions at this time, feel free to ask. Once inside the surgical suite or operating room, you'll be prepped for surgery, which includes getting the anesthesia that's best for you. As the anesthesia takes effect, you may feel drowsy or dizzy and will fall asleep fairly quickly. You can expect your surgery to last approximately 1.5 to 3 hours. After your surgery has been completed, you'll be taken to the recovery room to be monitored closely until you're awake from your anesthesia. Patients are normally in the recovery room for 30 to 60 minutes. Your length of stay depends on many factors, including your body temperature, blood pressure, pain level, and drowsiness level. We will do our best to keep your family informed during this time. Remember, a positive attitude makes all the difference in your recovery. In this section, we'll discuss your hospital stay, pain management, activity and breathing, your IVs, tubes, drains, and dressing, as well as provide you with some nutrition advice. Once you arrive on the inpatient unit, your nurse will continue to monitor your blood pressure, heart rate, temperature, and oxygen levels. You may feel sleepy for several hours after your surgery. This is a normal response to certain types of anesthesia. At LewisGale Regional Health System, we welcome and encourage your family to be involved with your recovery. Specific visiting hours for this facility can be discussed with your nurse. If you wish to see a chaplain at any time during your stay, please let your nurse know and we will be happy to provide you with this service. You will experience a certain amount of pain after surgery. Helping you manage your pain is one of our top priorities. You'll likely experience pain from the surgical incision, healing of the muscles, swelling of the joint, and bone pain. A numeric pain scale will be used to rate your pain, with 0 being no pain and 10 being the worst. You'll be asked to choose a number that best describes your level of pain. Your doctor and nurse will work together to find the most effective treatments for you. While you will not be pain-free, you will be able to get moving and begin your therapy. Physical therapy typically begins on the same day as surgery. The first goal is to get you up and standing on your new joint with the support of a walker. You will eventually progress to walking with a walker. Your nurse and physical therapist will also give you exercises to do in bed, which will help you to recover faster. Remember, moving will help you feel better. Fall prevention is also very important to us. Please do not attempt to walk by yourself until your nurse says that it is okay. As you recover, it's also important to take steps to prevent your risk of pneumonia. The amount of air in your lungs can be decreased after surgery due to pain medications, anesthesia, and immobility. Frequent coughing and deep breathing are recommended. In addition, an incentive spirometer may be used to increase the volume of air in your lungs. You can start by performing deep breathing techniques even before your surgery. To increase your lung volume, start by taking slow, deep breaths through your nose. Hold your breath for a few seconds and exhale deeply. Repeat this 2 or more times. After you exhale the last time, try to cough. Repeat this every 2 hours while you are awake. Next, we'll be discussing your IV line and other tubes and drains. The IV line started prior to your surgery will remain in place until it is discontinued by your physician. Other tubes and drains that you may have are catheters and surgical site drains. A catheter in your bladder is used to drain urine from your bladder. This will be removed within 24 to 48 hours after surgery. You may also have a drain in your joint to collect blood from the surgical site. This will also be removed within 24 to 48 hours following your procedure. Following surgery, a dressing will be placed over the surgical incision. The dressing is often much larger than the actual incision. Do not be alarmed over this. Your nurses will examine your dressing often to check for bleeding. The dressing will be removed and changed based on your physician's preference and order. Next, we'll be discussing your food and nutritional needs following surgery. Your physician may prescribe a clear liquid diet initially to ensure that you will not get sick. Once you're able to tolerate clear liquids, your diet will be advanced to a regular diet. Good nutrition is important both before and after your surgery to help you heal quickly, recover your strength, and protect the new joint. We encourage you to eat a well-balanced diet every day, consisting of fruits, vegetables, grains, lean meats, low-fat dairy products, or other sources of protein. Drink plenty of fluids, especially water. As you head home, your safety is a top priority for your continued healing. An occupational therapist will now share with you some home safety tips and recommended equipment.
Occupational therapy's role after joint replacement surgery is to help patients go home and be as independent as possible with their activities of daily living. Activities of daily living for us include anything you might encounter throughout your day. Could be bathing, dressing, toileting, household chores, and even food preparation. In order to maintain and help increase your safety and independence with these activities, we usually use home modification education, strength and endurance training, as well as tools and adaptive devices to increase your safety and independence. Occupational therapists will recommend some of your home safety modifications before you go home. Be set up before your surgery. These modifications could include and simply be making sure you have at least 3 to 5 feet from your chairs or beds to create space for your walker. You're also going to want to remove any rugs and trip cords, electrical outlet cords that may be crossing your pathways in order to reduce your risk of falls. You might also consider putting slip mats or safety strips in your bathtubs. And we also recommend increasing or making sure you have adequate lighting throughout the house. This might include adding night lights to your kitchens, bathrooms, or bedroom space. As far as home equipment goes, we have several items that we can introduce you to that will help you not only be safe and reduce your fall risks, but also increase your ability to maintain your precautions that were described to you earlier. One of the first things we might use to improve your safety and increase your precaution use is the bedside commode. This can be used in one of two ways. With the bucket in the bedside commode, you can place it next to your bed or chair, or where you may be spending most of your time. This will decrease the distance you have to walk and improve your safety. You can also remove the bucket from the bedside commode, place it over your toilet. This will give you a raised surface, making it easier to stand up from a sitting position, and also provides grab bars or handrails that you can use to push up from. To help with bathing and showering, you might consider use of a tub bench. The benches are placed in the bathtub with the back of the chair inside the tub with a lip hanging outside of the tub. And this is done so that you can maintain those precautions and avoid bending that hip. Do that by sitting on the edge of the tub, picking your feet up and over the tub, and sliding across the bench to position yourself. And now you're ready to shower. While you're showering, it can be difficult to bathe your lower body without bending that hip and breaking your precautions. So you'll likely want to use something like a long-handled sponge. This allows you to reach your lower extremities without having to bend. Once you've completed your shower and you're ready to dress, again, you want to maintain those precautions by not bending over. Getting your shoes and pants on can be hard to do without that, and so we'll provide other tools and suggestions for you to use. Starting with your pants, you may consider using a long-handled grabber or reacher, and these are used for pants underwear as well. You'll simply grab the waistband and what I like to call fishing for your foot. Slip the affected leg or the surgical leg in first, and then without breaking your precautions, you're able to pull the pants as high as you need to, and then you can place the other foot in as well. Once the lower body's been dressed with pants, you may need to get your socks on. Tools for that is known as a sock aid. Sock aids can be used for just socks and also for compression stockings that may be prescribed to you after the surgery that help decrease swelling. And the sock aids are used by simply placing the sock over the tool. This creates a gap for your foot and gives you something to use to, again, go fishing for that lower extremity. And then you simply pull the sock on your foot. Finally, donning shoes may require the use of a long-handled shoe horn just to help position the foot and create the space and leverage needed to get your foot in your shoe. There are other tools and equipment that may be introduced to you that you might find helpful, but these are ones that we recommend everybody use in order to increase their safety as well as maintain their precautions.
When it's time to leave the hospital, you have several options for your continued recovery. Your options include going home with outpatient therapy, going home with home health therapy, going to a skilled nursing facility with rehab services, or going to an acute inpatient rehab facility. Your care team will discuss all of these options with you and your family. This concludes the LewisGale Regional Health System Joint Class. We hope that this information has been beneficial for you and that you feel more informed and ready for your surgery. We look forward to caring for you and thank you for choosing LewisGale Regional Health System.